A lot of strikes going on at the moment. You're being very resolute as things stand in standing up to the unions. It's not proving very popular with the public. Again, 3/4 think the unions have got the edge in this at the moment. I want to talk specifically about nurses, mainly because your father was an NHS GP, your mother ran the family pharmacy. You're a person who grew up around the health system, around healthcare. It must burn in your soul. Nurses, we were told to go out and applaud every Thursday in the pandemic. Many of them died in the pandemic, risking their lives to save people's lives. They, to me, should be made an exception, and yet you barely negotiated with the nursing unions. Do you not feel this duty that you talked about to actually take care of nurses and say, actually, we do have to make some exceptions, and at top of my list, my priority is going to be nurses, and give them a proper pay rise?
You know, you're right, nurses should be an exception, and that's because they do an incredible job for all of us, and they demonstrated that during the pandemic, and I'm really grateful to them for that. And you're right, I grew up in an NHS family, so this does burn deeply inside of me because I know how important great healthcare is for people, and including my own family. And we did treat them as an exception. You know, people forget that actually during COVID, when I was Chancellor, we instituted a public sector pay freeze because actually wages for most people were going down. And what we decided in that context, given everything going on, that there should be a pay freeze across the entire public sector. So everyone working in the public sector didn't see their wages rise during COVID, given the economic situation. But you know what? There was one exception to all of that. It was people working in the NHS.
Yeah, but it
was nurses.
I know, but it's all been completely dwarfed, as you know, by inflation.
But hang on, no, but your principle, though, that
yes,
we should treat is one that I agree with, and it's one that I've actually delivered when I was Chancellor. So I think
are you going to deliver again now you're Prime Minister?
And now when we're talking about this, and I'm really glad actually to have an opportunity to talk about it. Now, look, it's not always easy in this job because I'm focused on doing what I believe is right for the country and in the long term, and often that means doing things that maybe not always popular, and this is a good example of that. But let me explain why we're doing what we're doing and why I think it's important. Look, I would love to give the nurses a massive pay rise. Who wouldn't? Certainly would make my life easier, wouldn't it, right? Of course I would love to do that if I could.
Give them one then.
So why is that tough, right? Why is it tough? It's about choices. So right now, there's a record amount of money going into the NHS. Record amount. And in spite of those difficult decisions that we had to make to stabilise the economy, which were the right decisions, we found more money for the NHS and social care because I believe that was the right thing to do. So right now, the money going to the NHS, biggest it's ever been. But we have to put that in lots of different places. We need to hire more doctors, more nurses. We need more scanning equipment so we can detect cancers early. We need more ambulances, so we're doing all of that.
I understand, but to do that, to recruit people, you've got to make them think there's an environment that's worth working in, that they're going to be actually treated in the way that we treated them in the pandemic with all our applauding. I mean, one specific thing I really got my goat about the nurses is in the pandemic, after a campaign which I led actually, car park charges were removed from all hospitals for nurses. Right, because they were paying up to £1,000 each a year to park their car outside a place they were going in to save lives. It seemed to me preposterous. In Scotland and Wales, they don't have that charge. But now the pandemic's over, that's come back. And they're now facing charges again of £1,000 a year. You can't think that's right. Surely the nurses in England have to pay £1,000 a year for the privilege of parking outside a hospital to save lives.
So actually what we've done is put in place support for trusts to be able to support their staff.
Why don't you just say enough?
Well,
you should and just continue what happened in the pandemic.
Yeah, well, because there's other things that we've done for nurses as well. Because you're right, it's not just about pay, there's lots of other ways.
You know that's not fair, don't you?
Well, there's other ways that we can demonstrate
but
our
on that point, though, it's not fair, is it?
Well, look, everyone watching this show will get to work in lots of different ways.
I know.
Right?
I know, but not many are actually going to save lives. And they're paying £1,000 on average for the pleasure of parking outside a hospital. It's ridiculous.
Yeah, and that's why we've put measures in place, actually, and more funding to ease the burden of hospital car parking charges. Not just on employees, but also on patients who are there on a regular basis.
But actually what's happened is a lot of these trusts have actually put the prices up. They're now paying more, the nursing staff, than they were before the pandemic. Again, I simply say to you, that's not fair, is it? It's not right.
Well, here are some of the other things we're doing, right? Because again, this is all...
Don't change the subject. On that, it's not fair and right, is it?
Well, let me tell you some of the other things we're doing.
I know you don't think it is.
Well, look, of course, would I love it if people had to pay less to get to work? Of course I would, right? And of course I'd love that for everybody.
Why are nurses in Scotland and Wales valued more? Why don't they have to pay to park?
Well, that's not quite fair. That's not
true.
quite fair. What the nurses were also...
They don't have to pay for parking.
Nurses were also on strike in Wales.
They don't have to pay for parking.
They also pay higher taxes. A typical nurse in Scotland pays higher taxes than they do in England. Right?
Will you at least look at that?
Of course I'm happy to look at that. Right? Of course
I think you should. I think it's a big deal for a lot of these nurses.
But this is really important. So look, here are some of the other things that we've done, and then I want to get on to the point on pay. But so you're right, because there's lots of other ways we can value people. We've reinstituted nurses' bursaries. So if you're training to be a nurse, £5,000 a year bursary. That's not available for people studying other subjects. That's because we care about nurses in particular. You asked they should be treated differently. They are. That's very generous. Something else the union asked us for a year before last was when nurses qualify, we want to keep supporting them because they want to keep learning new skills so they can help more patients. We said, great, we'll support that. £1,000 of a training budget for every newly qualified
but here's
nurse.
The problem with...
So let's get on to pay though. So I just want to say
here's what you're not mentioning
things
in this context, which is raging inflation means that all this stuff has been completely dwarfed.
Yeah.
So you know as well as I do that nurses are actually out of pocket. Despite all this, they're massively out of pocket because of inflation. And I think that if the country is told to go out and applaud these people every Thursday for risking their lives in a pandemic, and our reward is to kick him in the teeth the moment it's over, I don't think it's fair.
So I don't think that's a fair characterisation of it. I don't think that's a fair characterisation of it at all. Right? But look, this is really important. So give me a second to explain. So nurses are getting a pay rise. They're getting a pay rise of about 5% and much higher actually for lower paid nurses. So that is happening, right? And it goes back to the question of there are all these other things that we need to do in the NHS as well. We need more nurses. We need more ambulances. We need more scanners. No, but this is... The other thing is about... So look, I don't think anyone watching this show, or you as well, would say, OK, great, we need to put up everyone's taxes to pay for that because the money has to come from somewhere, doesn't it? Right? I don't think that's what everyone is saying. The other thing is, you're right, the thing that is making life difficult for nurses and for everyone else is inflation. It's the bills that are going up and up and up. We've got to tackle inflation. That's why it's the first of my 5 priorities. And unfortunately, in a situation where you've got high inflation, if lots and lots of people get very large pay settlements, it makes the inflation problem worse and last longer, and that is not going to help anybody, including nurses. And that's why, even if it's not popular, it's the right thing for the country to stay the course.
I hear